Welcome to Healing Horizons, Ibogaine Therapy in Mexico. I'm Chris Daniels, your host, and today's episode is Escape the Opioid Trap, Why People Are Going to Mexico for Ibogaine Therapy. I'm going to walk you through what Ibogaine is, what the science suggests, why Mexico has become a hub for medically supervised treatment, and how to pursue this option as safely and ethically as possible. Quick but essential disclaimer. This podcast is educational only, not medical advice. Ibogaine can carry serious risks and is not FDA approved. Always consult qualified clinicians who can review your history, medications, and lab results before making any treatment decision. The opioid crisis has entered a new deadly chapter. Fentanyl has saturated drug supplies, overdose deaths remain high, and many people feel trapped in a cycle of withdrawal, short-term detox, and relapse. Standard treatments like buprenorphine and methadone can be life-saving, yet access, stigma, side effects, and individual fit lead some to search for alternatives. Families call me after years of revolving door rehab, asking if there's anything different. That is where Ibogaine comes into the conversation. Not as a magic cure, but as a tool that, for some, can rapidly interrupt physical dependence while opening a window for deeper therapeutic work. So what is Ibogaine? Ibogaine is a naturally occurring alkaloid found in the Tabernanthe iboga shrub, used for generations within the Bwiti spiritual tradition of Central Africa. People sometimes confuse iboga root bark with purified ibogaine hydrochloride. Root bark contains multiple alkaloids and is typically used in ceremonial contexts. Ibogaine HCl is a single compound produced for medical protocols where dosing and pharmacokinetics can be standardized. After ingestion, the body converts a portion of ibogaine to noribogaine, a long-acting metabolite thought to contribute to mood stabilization and reduced cravings in the weeks following treatment. How might ibogaine interrupt opioid dependence? Several mechanisms are proposed. Ibogaine appears to interact across multiple receptor systems, including NMDA, kappa opioid, sigma, and cholinergic sites. This broad activity may reset aspects of neuroadaptation that drive withdrawal and compulsive use. Noribogaine inhibits the serotonin transporter, SERT, and may modestly affect dopamine and kappa signaling, which could lift mood and blunt dysphoria post-detox. Clinically, many patients report markedly reduced acute withdrawal, a sharp drop in cravings, and improved sleep for days to weeks. That window doesn't fix life by itself, but it can make therapy and behavior change far more attainable. What does the evidence say? We have encouraging observational studies and clinician reports showing decreased withdrawal severity, lower short-term cravings, and improved mood after Ibogaine for opioid use disorder. Small prospective cohorts suggest that when patients receive solid aftercare, abstinence or reduced use at 3 to 12 months is achievable for a meaningful minority. That said, rigorous randomized trials are limited, dosing strategies vary, and publication bias is possible. Importantly, Ibogaine is not approved by the FDA, and professional bodies call for larger controlled studies. The science is promising, but it is not definitive or universally predictive. There are also ongoing trials in several countries now. Why are people traveling to Mexico? In Mexico, Ibogaine is not scheduled at the federal level, allowing licensed physicians to operate within private medical facilities under local regulations. This has led to a network of dedicated clinics with cardiac monitoring, hospital partnerships, and multidisciplinary teams. Proximity to the US and Canada lowers travel time and cost compared with more distant countries, and some centers combine medical protocols with retreat-style environments for preparation and integration. That availability doesn't guarantee quality, but it does mean patients can realistically access supervised care without the legal barriers they would face at home. Spanish-English bilingual staff and proximity to family can further ease the transition from detox to early recovery. Safety comes first. Ibogaine can prolong the QT interval on an EKG, predisposing to dangerous arrhythmias like torsades de pointes. Seizures, ataxia, nausea, and electrolyte shifts can also occur. Most reported fatalities have involved inadequate screening, hidden cardiac disease, drug interactions, dehydration, or unsupervised use. That is why medical clearance and continuous monitoring are non-negotiable. A reputable clinic will rule out structural heart disease, correct low potassium or magnesium, avoid co-administration with other QT prolonging agents, and keep you on a cardiac monitor with airway and resuscitation equipment ready. Without those safeguards, the risk profile changes dramatically. Medication interactions matter. Methadone strongly prolongs QT and typically must be tapered and transitioned off before Ibogaine. Other QT prolonging drugs, certain SSRIs and SNRIs, tricyclics, antipsychotics, macrolide antibiotics, fluoroquinolones, some antifungals, may also require adjustment. Stimulants, MAOIs, and sertraline or fluvoxamine can raise risks or alter metabolism. Heavy benzodiazepine or alcohol dependence needs separate medical management first to avoid dangerous withdrawal. You are generally not a candidate with uncontrolled heart disease, significant liver impairment, electrolyte imbalance, active psychosis, pregnancy, or a seizure disorder without specialist oversight. Safe tapers should be coordinated by a prescriber who can monitor you. What does a reputable medical protocol look like? Start with comprehensive intake. Medical history, substance use timeline, medication list, and psychiatric assessment. Objective screening includes 12-lead EKG with QTC, echocardiogram when indicated, CBC, CMP, LFTs, magnesium, phosphorus, pregnancy test when relevant, and infectious disease screening. On-site, clinics should use test dosing, slow titration toward a planned total dose, continuous cardiac and pulse ox monitoring, frequent vitals, and IV access. Staff should be ACLS trained with a crash cart, defibrillator, and medications for arrhythmias and seizures, plus a documented hospital transfer agreement and clear emergency protocols. Let's talk about the treatment journey. After intake and medication review, many clinics schedule a pre-treatment stabilization period to optimize sleep, hydration, and electrolytes. Some use a low-dose priming day, followed by a single flood dose, or a series of divided doses over 12-24 hours. The acute phase often involves vivid, introspective imagery with eyes closed, alternating with periods of wakefulness and ataxia. Walking unassisted is unsafe. Nausea is common. A composite example. A patient on short-acting opioids tapers receives test doses, then a flood dose at night. By morning, withdrawal is muted, cravings are quieter, and sleep returns. Preparation increases safety and outcomes. Get medical clearance from a local clinician who is willing to communicate with the treating team. Complete lab work and EKG early so there's time to correct abnormalities. Work with a prescriber on careful tapers from methadone or other interacting medications. Do not stop anything abruptly. Improve nutrition, hydration, and sleep in the weeks before travel. Mental preparation matters too. Clarify intentions, identify triggers, and set up a concrete aftercare plan with therapy, peer support, and accountability. Decide in advance how you'll handle cravings, boredom, grief, or conflict when you return home. Integration is where change sticks. In the weeks after Ibogaine, consider weekly psychotherapy, mutual help groups, or recovery coaching. Build routines, regular meals, exercise, sleep, and structured days. Some patients combine Ibogaine with evidence-based care, buprenorphine microdosing for stabilization, extended-release naltrexone when appropriate, or SSRIs for co-occurring depression under medical supervision. Crucial harm reduction. Your opioid tolerance may be dramatically reduced, so any relapse carries heightened overdose risk. Carry naloxone, inform trusted people, and avoid using alone. Establish a buddy system and a crisis plan. Relapse is a signal to adjust supports, not a verdict on your worth. When choosing a clinic in Mexico, verify physician credentials, experience with cardiac risk, and compliance with health regulations and COFEPRIS oversight. Ask for written protocols, hospital transfer agreements, aftercare planning, and transparent reporting on outcomes and adverse events. Clarify what documentation you'll receive, how prescriptions are handled, privacy protections, and clear re-entry guidance. Discuss travel logistics, length of stay, and price. Typically several thousand to low five figures depending on medical intensity and amenities. Request itemized costs and refund policies before paying a deposit. Seek clinics that source Ibogaine ethically, either synthesized or from sustainable, legally verified supply, and that honor Iboga's Central African roots with cultural respect. A brief composite story to ground this. After years of fentanyl use and multiple detox attempts, a patient tapers to short-acting opioids, completes cardiac workup, and travels with a parent. The clinic corrects low magnesium, primes with small doses, then administers a carefully monitored flood dose. Withdrawal is muted within 24 hours, and the patient rests for 2 days. Back home, they enter intensive outpatient therapy, attend peer meetings, and rebuild sleep and nutrition. At month 3, cravings spike after a breakup. A relapse plan prevents a spiral. By month 6, with steady supports and purpose-driven routines, use remains in remission. That's our look at why people are going to Mexico for Ibogaine therapy. The crisis context, what Ibogaine and Ibogaine are, how treatment may interrupt dependence, what the evidence shows so far, the legal and practical reasons Mexico has become a hub, and, most importantly, how to approach this option safely. We covered risks, medication interactions, protocols, preparation, integration, overdose prevention, clinic selection, costs, and cultural respect. If Ibogaine is on your radar, take your time, consult qualified professionals, and build a robust aftercare plan. I'm Chris Daniels, and this is Healing Horizons. Thanks for listening, and take good care.